Hello, this is Dr. Chris Habib, and I'm sitting here. I have the pleasure of chatting with Dr. David Lee, chiropractor and acupuncturist. We're going to be discussing some of the conditions that chiropractors treat. Dr. Lee, thank you for taking the time to be with me today.
Thanks for having me.
So let's start off with a question that I know my patients ask me a lot, which is what types of conditions do chiropractors treat?
Good question. What chiropractors are famous for is treating low back pain. Okay, and we're very, very good at it. In fact, a lot of studies worldwide have confirmed that chiropractic is safe and effective for low back pain.
Mm-hmm.
What's less well known is that we also treat a lot of other things that involve the muscles, the joints, and the ligaments of the body. Okay, so that can involve things like headaches, neck pain, shoulder problems, rotator cuff, tennis elbow, wrist problems like carpal tunnel, sprains, hip problems like bursitis or arthritis, knee problems, ankle, pretty much any joint and muscle in the body.
So it sounds like if I get hurt, you're the guy to come see.
Yes.
Okay. So then, I mean, some of these things that you're talking about, like the low back pain, for example, these conditions can be quite debilitating. What types of patient outcomes can be achieved?
In terms of outcomes, for the majority of patients and for majority of conditions, full resolution is actually attainable.
Wow.
It requires working both with the patient and the chiropractor themselves. Okay, so from the patient's end, they need to do the proper exercises, be it stretching or strengthening or balance exercises. In addition, they have to modify their lifestyle. From our end as chiropractors, we have lots of tools that we use. Okay, things like therapeutic ultrasound, laser machine, electrical muscle stimulation, hands-on work to stretch and loosen up the muscles, and mobilizations and manipulations.
Wow, so it sounds like you have quite the tool belt available to you. But can you give an example of what you might see or what you've experienced?
In terms of, actually we had a patient last week who is a consultant, and he's on the phone a lot with clients and also on the computer a lot. And he came in kind of stuck like this. And what we found out was that he's using his phone and holding it up like this, like that. So in terms of instructions of what to do to recover and to prevent future recurrences, get a headset. Change the setup of your work area. So that would be some of the things that patient lifestyle
on the patient end of things. That makes perfect sense. So then, let's say someone wanted to find a good chiropractor in their neighborhood. How would you recommend they go about that?
The best way, like anything else, is to get referrals from your friends, family, co-workers, other healthcare practitioners as well.
Okay, so basically people that you trust that have gone through the process.
Absolutely.
Okay,
absolutely.
That makes sense. And now, I know you yourself are an instructor with the Chiropractic College. You yourself work in an integrative clinic. What if someone wanted to come see you in your Midtown Toronto clinic? What could they expect at a visit?
Typically, after filling in all the forms, what we do is take a history, a very thorough history. So it's asking you questions specifically of your problem, how long you've had it for, where it is, what aggravates it, what makes it better, also asking you what your goals are. Okay, so the buzzword is kind of patient-centered care.
Oh, okay.
So we have to integrate that. We should integrate that.
That makes sense.
And after the physical examination, come up with a diagnosis, tell you what the problem is, and explain to you what you need to do on your end and how we can help you here, how often you need to come, and how long it would take.
That makes perfect sense. It sounds also like you're being very thorough and you're obviously taking into account what the patient wants, which is fantastic. So then, what would you say is the best way to get in touch with you if someone wanted to contact you?
Best way is actually our phone number, of course, and our website.
Okay, so just from what I can see here, then your phone number is 416-792-4400, and your website is mahayaforesthill.com, and that's Dr. David Lee, working in Midtown Toronto. Dr. Lee, thank you so much for taking the time to chat with me today.
Thanks for having me.